So the audience, welcome. Philipp Ivanyi is my name from the Comprehensive Cancer Center in north of Germany, Hanover. And I'm here at ESMO 23, also focusing on, let's call it precision oncology itself, because we have had novelties. To give you an overview, I think we have three categories of forward-moving fields in precision oncology. The one is enrichment design trial, generating statistical evidence, very successful in particular in non-small lung cell cancer. We have the other approach of mechanistical evidence, what means we are taking any cancer, measuring NGS whatsoever, whole genome, and then we are using a drug guided against a potential alteration. With this approach, we really do not know where we end up, and it's still a field of moving. And we have the last one, the diagnostical impact itself of NGS and other spacey techniques, at least from the medical oncology side. So, and we have a field which fuses basically all three topics perfectly. This is a field of cancer of unknown primary. And we have two diagnostic therapeutical trials, worth to mention, and one diagnostical trial. I group simply the two therapeutical diagnostical trial together. The one was the CUPISCO trial, late breaker. What they did is after a conventional chemotherapy, they randomized either continuing with chemotherapy or with a molecular guided therapy, and progression-free survival and overall survival showed really an impact of the molecular guided therapy. The second one, they did it upfront in molecular stratified therapy compared to conventional therapy, and what you see here really in good improvement of the overall survival, which surprises me, to be honest. The other one was simply, this is an old question, reclassification of CUP syndromes based on NGS. And what they saw here, they renamed, they re-diagnosed 1/3 of those CUPs towards a specific disease. This is something we knew, but this should encourage you potentially in day life to consider about NGS and CUPs. Then, of course, diagnostic is an important question, and we have a really good trial done by the EORTC and ARCAGEN for rare cancers and rare diseases, where they prospectively collected specimens and reclassified based by NGS and examined potential druggable alteration. And surprisingly for me, because it's different from my molecular tumor board, in 40% of the analyzed specimen, alteration worth to potentially drug them have been identified. The last chapter about precision oncology is the therapy. And I saw two awesome trials. Have been plenty. One was the Destiny pan-tumor approach in several different cancers with HER2 alteration. HER2 inhibition in those heavily pretreated shows nice activity. And we have a late breaker, which is practice changing in medullary thyroid cancer, where we enriched red alterated, and here we have a new standard with an impressive overall survival and PFS with zelpercatinib in those classes.